Hey friends, welcome to Functional Medicine for Moms, where we take root cause approach to fertility, pregnancy, postpartum, and raising healthy families. I'm your host, Dr. Kelly Moline, a pharmacist and functional medicine consultant. Whether you're preparing for pregnancy, trying to conceive, navigating life with a newborn, or simply looking for practical ways to support your health naturally, you're in the right place. Each week, we'll dive into functional medicine, natural solutions, and honest conversations from our own family's journey, plus interviews with experts along the way. Let's get into it. Welcome back to our podcast, Functional Medicine for Moms. Thanks so much for returning, or if you're new here, we're so glad to have you. We have been going through a preparing for pregnancy series as I've recently launched a preparing for pregnancy guide. So I'm very excited to talk today about the nervous system and how nervous system regulation impacts preparing for pregnancy. When we're talking about preparing for pregnancy, we're talking all about optimizing the success rate of conception. We're talking about optimizing health during pregnancy, optimizing health for the baby and postpartum, all of the above. So I created this guide so that it's a one-stop shop for people who have questions about what can we be doing to make our bodies healthier, to optimize everything, and especially when we're talking about fertility. And when I was creating this guide, I talked to a lot of local practitioners to make it as holistic as possible. I have a background in pharmacy, and so I know a lot about the supplements, labs, and lifestyle, but I had other aspects in my guide that I wanted to cover, like the nervous system. And as much as I know about nervous system and cortisol and how to balance that, I talked with Dr. Austin, who's joining me today, about the nervous system regulation and not only why it's a foundation for preparing for pregnancy, but why it should be our first foundation. So after talking to him, I reordered my guide a little bit. So I moved nervous system regulation from number 3 up to number 1 because it's really that important. So I have Dr. Austin with me today. Dr. Austin is a neurologically-focused chiropractor and founder of Lighthouse Chiropractic in Flower Mound, Texas. He is Webster certified and PX neurolator certified with a focus on helping the nervous system regulate, adapt, and heal. Dr. Austin works closely with women through preconception and pregnancy and has a passion for pediatric care, supporting kids of all ages, including many babies born to the mamas he has cared for. His faith is foundational to his work. He believes God designed the body and an incredible capacity to heal, and that a calm, regulated nervous system allows that design to function as intended, supporting fertility, healthy pregnancy, and a thriving family. Dr. Austin is local to Flower Mound, where he lives with his wife, Corinne, and their sons, Cyrus and Jonah, and they are expecting a baby girl in July. Oh, that's so exciting. I didn't know you were having a baby girl.
Well, yeah. Well, at least according to what they say, according to what we found on there. So yeah, they mess up sometimes.
Yeah, well, the one I have, girls are a lot of fun, so I'm sure your boys are just going to adore her.
Hopefully, they're a
Yeah.
blast too. So
So welcome, Dr. Austin. Thank you so much for coming on our podcast.
yes, thanks for having me. I'm excited to talk on the nervous system and kind of how it applies into this whole, I guess, amazing, beautiful God created cycle and kind of what it goes into and what you said foundational for with the body.
Yeah. So let's get really down to the basics on what nervous system is. I know when I generally think about nervous system, we're thinking about the stress response system, like cortisol and all of those things. But I know chiropractic sees it as more of like the structural level as well. So can you dive into what the nervous system is and what nervous system regulation is?
Yeah, I mean, the nervous system is what builds us, it's what, it forms us in our womb and all that. And so it is so intricately done and we only know a fraction of really like what the body's capable of, but it's so cool because nothing happens in our body unless our brain and our nerves are like communicating it. And so, people go like, brain dead for not to go into that, but it just means that things are no longer going to function because the brain's not communicating to the body. And so, and it's a two-way system too. Our brain's sending things out and it's also receiving. So there's a sense There's a part of it is, I guess, sensation or what we're seeing, what we're feeling, what we're taking in, but it's also what we're sending out. And so there's communication and reception there.
Yeah, when I see the nervous system, like, on a picture, like, in your office or other offices, it goes through the entire body, like you said, it's the nerves that going through from the brain all the way to the whole body, kinda like a tree with branches and
Yeah.
the stems and leaves and all of that.
Yeah, definitely. It's the network of communication in our body, and so like I'd say that's the simplest thing. Is it is the wiring of our body, and so if you want something to happen, your nervous system needs to tell it what to do. And so if that nerve is going to your heart and it's not working right, that heart might not beat as well. That your lungs might not breathe as well. Like so, there's a lot of important functions, and so we want to make sure that everything is truly just communicating well, and that's our biggest goal within what we're doing is, hey, how do we remove interference in this nervous system? And what we do as a profession is we're not healing people. We're just taking the body, looking at what's going on and identifying what's happening in the nervous system. And how do we just remove that interference to get it back to, I would say, the state that God designed it to be. We put the stress and we put the things, like usually the barriers in the way that stop our nervous system from doing what it should. And so it's all about how do we get back to that? How do we get out of our own way, get out of our own stressors, and get it back to healing again?
Perfect. So I know I've been to a chiropractor who did the insight scan, and the insight scan is something that can actually see a lot of those interferences as well. And please correct me if I'm wrong, but that's a tool that you're able to use to really look at the nervous system as a whole. Can you dive into that? And I know you're talking about interferences and how the body is responding. So, can you dive more into how that can be useful?
Yeah, yeah, for sure. I would say the inside scan is something that is like pivotal for someone who is looking at the nervous system through chiropractic care. And so it's, the same reason people are using like aura rings that, track their health and their recovery. Same reason other wearables and different, things that we're tracking. It's because it's talking about like the health of our body, our nervous system as a whole. And so there's three main scans that we do with the inside scans. And so the first one's called a neuropulse. So it's essentially a very complex like heart rate variability. And so it's one of the ones that, and when a lot of times, going off the topic of fertility and all that, heart rate variability is one thing that people talk a lot more about because it's measuring the system as a whole. Like, how is the nervous system functioning? And so the more adaptable a nervous system is, the higher the heart rate variability will be, because a system that's stuck in a sympathetic or a fight or flight state, which is a protective state, is not going to be too adaptive. It's going to be in that zone, basically. So we're measuring heart rate variability, which is a big measure of the autonomic nervous system. So simply put, it's everything that's happening like automatically in our system. So things that ideally we don't have to think about, they're running behind the scenes. And so that's one of our first scans. Really cool to look at the body as a whole. And it factors in a lot of our lifestyle things that play into it. Additionally, we do the neuro, so this is the neuro EMG, which that's like it's measuring the electrical activity of the muscles. So I basically say it's a neuro EMG because it's measuring what the brain is telling the muscles to do. So it's measuring the communication and the electrical signaling of those, of the nerves through there. And so muscles don't just tighten up on their own. And so basically the body's telling certain areas to protect, and it's also sometimes shut off or exhausted in certain areas. And so we're getting to measure that, kind of see how these patterns are showing up, see what's going on in the motor system, so some of the output of the body, and seeing how that communication is going on there. And then lastly is the neurothermal scan. And so that one's looking at, it's a fancy word like dysautonomia. So it's looking at that imbalance of that sympathetic parasympathetic in regions of the body. And so by measuring that thermal output, because our body is regulating our temperature. People talk about babies that are struggling to like stay warm and stuff like that. It's like our nervous system is what regulates that. And so if we were looking at the temperatures of the body, it should pretty much be unified. Our body should be essentially warmer the closer we go to a lot of the more important organs, the brain being one of the most important organs there. So we get to measure the temperature all the way up the spine and see where we have like inflammation going on, where there's hyperactivity within systems of the body, which is going to come with warmth versus like cooling in those areas. And so basically collectively, we get to pool all three of those scans and get a lot of detail about, and objective detail too, about what's going on in the nervous system and start to relate it back to this person's history or this person's symptoms that they're dealing with. And so it's a really cool scan that basically takes us from going from symptoms that people are talking about, but going back to what the root cause is. Because if that nerve that goes to, for fertility's sake and all that, so there's the HPV or HPG and HPA, which is the hypothalamic pituitary gonadal versus adrenal. And so if your body's in fight or flight, your body is going to be very stressed, very protective. We're going to shift into that adrenal side. And so body's going to shoot up cortisol. The body's going to not really be prioritizing HPG because you can't really have those going at the same time. And so in order to have the proper hormones and all that kind of stuff, we have to be able to regulate the nervous system, get out of that sympathetic state to where our body can go back into calm, regulated parasympathetic function and actually have that good, start to life or the conception of life. I'm saying it kind of simply, but that's kind of at its root. What we get to measure through all of those together is like, hey, how is stress showing up in the nervous system and how can we remove those interferences, which chiropractic wise we call subluxations. So it's basically misalignments, fixations that happen in the nervous system that are causing the body to no longer adapt properly, no longer to communicate properly. So most often when things are not working right, our body's like, this is wrong, something's stressful, something's like we're trying to do something differently rather than what the normal path is.
Hey friend, real quick before we get back to today's episode, if you're hoping to conceive within the next year, currently trying to get pregnant, or wondering if there's more you can be doing to support your fertility, I created something specifically for you. My new Preparing for Pregnancy Guide is a comprehensive resource that walks through the foundations of fertility and preconception health from a functional medicine perspective. We cover nutrition, blood sugar balance, sleep, stress and nervous system support, gut health, supplements, ovulation tracking, male fertility, fertility testing, and even considerations for IUI and IVF. I created this guide because so many couples are told to just keep trying and wait when there are often practical steps you can take right now to support your health and fertility. Whether you've been trying for a few months, are planning ahead, or simply want to feel more prepared before pregnancy, this guide will help you create a clear plan and understand where to focus your efforts. You can find it at molinmethod.com/fertility. And because you're a listener of the podcast, you can use the code podcast25 to save $25 at checkout. All right, let's get back to today's episode. You're really covering, I think, the big question of what the nervous system has to do with fertility, which I think I review a lot of our body has only so many resources. And so we're either under that fight or flight or that rest, digest, and that's where we can reproduce and focus on hormones and recover and all of that. So our bodies can go back and forth, but we want it to be in that rest, digest, recovery, be able to reproduce, especially when we're talking about fertility. Is that correct?
Yeah, definitely. It's super important. Comes back to adaptability. And so if we get stuck, and that usually means stuck in that fight or flight, especially just with how I feel like our country as a whole is I feel like people get stuck in that protective state and it's hard to get back to that prioritizing rest, recovery, healing. And that's where good reproduction really comes from too.
Perfect. And so I think when people think of nervous system regulation, we think of, okay, let's meditate, let's have deep breaths, and which can definitely be a part of it and a big part of recovery. But with the insight scans and with chiropractic, I imagine that you talked about those thermal spots showing hyperactivity in different areas. And how does that have to do with chiropractic? I know when we think of chiropractic, it's cracking the bones and all of that. So can you explain how those are related to each other and what your role is in that?
Yeah. So I would say essentially what we're getting to measure is like, hey, where is the dysfunction of the nervous system showing up? And how is it showing up? And so the scans themselves kind of guide where and how we adjust. And not only that, but I would say one of the things that's really important is like how often do we do it? And so there is definitely factors like, hey, you can do, you can gargle water, you can sing, you can, go on a vibe plate, you do a stimulator around the vagus nerve, like all kinds of different things to help regulate your system. But those are things that are aiding that system. And so basically it's if that system is stuck one way, if that system is in that protective fight or flight state, you have to really get the body at its root to get back to a state of being able to adapt. Because then everything you throw at it, everything you do on top of it can benefit the body more. And so it kind of goes into, I know we talked a little bit about the hierarchy of healing and that nervous system being like the foundation of it. And so there's a lot of internal and external things you can do. But if that nervous system is not at its root, just adapting and changing and controlling things properly, that's where we get stuck into those patterns. And so those scans allow us to look at it more detailed across those three things and be like, hey, where is stress showing up chronically? Where are areas that are overactive or even exhaustive in the nervous system? And how do we work on restoring the communication? Because kind of like I was telling you, I'm not touching people and healing people, like there's some degree of healing that comes from touch. That's a true thing and all that. But I'm not Jesus, so as much as I try to be like him every day, there's a big component of our body that has this innate ability to heal, which is so cool. But our goal is to find those interferences from that normal design there. And how do we remove them? And how do we let the body express health and express its optimal function? And that's different for everybody. Everyone's got their own things they're dealing with. But if we can get each person's nervous system to have the best possible chance of expressing that health, you can see a lot of really cool things. A lot of our phrasing, we talk about like experience miracles, and that has a faith component, but also a nervous system component, because there's a lot of things that can happen when we get stress out of the way. And so I say stress, what we're talking about on scans, very simply put, is just stress in the nervous system. And so there's three kind of main things that we see stress show up though. It's going to be physical stress, chemical stress, and emotional stress. And so, that's why, we talk about, probably what you talk about with people too is like, hey, how do we eliminate the toxins? How do we optimize the things that are coming into your body? And so that can be through foods, supplements, all that kind of stuff. How do we eliminate the chemicals? Maybe it's all the fragrances and artificial things that are affecting their endocrine system and all that. So how do we limit those stressors? How do we limit the emotional stress? Easier said than done. Talking to a therapist, going to church, praying, all those kind of things can be really helpful. And then also, how do we limit the physical stress? And so our postures, our positions, our strains, it can come back to, it's like, hey, I hold a kid on this hip every single day. Or it's like I'm breastfeeding and I'm predominantly leaning on a chair here. Or I am on a computer and I'm hunched forward. I'm on a phone and I'm down here. So all of those stressors can add up. And that's what we're ultimately trying to do is how do we take those areas that have been stuck in that way and are just kind of stuck in a cycle? And how do we start to break that cycle? And so sometimes it's how often do we need to get them to come in? Maybe they've done chiropractic care before. Maybe they've never looked at the nervous system, even though that's something they're going to inevitably impact. But how do we strategically care for somebody with their nervous system?
Sure. And so it's my understanding too, chiropractors help the misalignments, especially like in the spine. And the misalignments and correcting those misalignments can really help that nervous system. And when there's misalignments and the nervous system is stressed there, that sometimes it creates like a different pathway, which may take longer and more energy for the body to be able to create that pathway and to complete that pathway. Is that correct? Am I heading in the right direction on
Yeah, to
how
a degree.
chiropractic can help?
Because there could be like a maladaptive state versus a like adaptive state. So it's like doing things, but just not as efficiently as it really should. So it's going to inevitably, cause you to burn that battery or normal like battery a little bit more and work a little more inefficiently on things that we're trying to naturally do. So it just,
Perfect.
Yeah, it's a simple way of saying it, and I would say the nervous system's super complex. So
Yeah.
we work on simple things all the time because we have to make sure that people understand this is what's going on in your body, this is what's going on in your nervous system, and this is what we're going to try to do to, take the training wheels off to get it back to where it should be,
Mhm. And I guess my point with that is how chiropractic can help get you there faster, or get you there in a more complete way. Because, like you talked about, the gargling, the humming, the meditating, all of that can be really helpful to regulate and to stimulate that vagus nerve to help you regulate. But it may not be like the main source of healing. And so there can be like other ways, like chiropractic, especially a nervous system focused chiropractor, to help you get there.
Yeah. And I just thought of this too, but like to go off what you were saying with that is if your body, people talk about sympathetic versus parasympathetic. So sympathetic being the fight or flight side of the nervous system. Most often people are like, hey, sympathetics, it's kind of like if you're running from like a lion. And so if
Mhm.
you're running from a lion, you want your blood to push into the extremities. You want your body thinking, I'm going to perform, I'm going to optimize this, I'm going to be sharp and aware and alert. And so if your body's in that state where it's doing all those things and you're trying to sleep, that's going to be kind of difficult. Like, yeah, you might, be trying to sleep between the hunting and the tracking and all that kind of stuff, but you're going to hear every twig snap, every, leaf ruffle, like all those kind of things because your body's in that protective state. So your sleep quality might not be as good. And so there's a lot of things that kind of coincide with that. But, going back to the regulation through like, the vagus nerve kind of exercises and regulation and singing and all that kind of stuff is if you're being hunted by a lion and you're still trying to escape and you're gargling water to try to regulate your nervous system, it's like you're opposing something that your body's already like naturally trying to do, or like you're trying to pull it out of a state that it thinks it needs to be in. And so, and if your nervous system doesn't perceive safety, then it's hard for those things to be as effective. And so it's basically, there's no eyes inside our body. It's all through that sensation, all through the nervous system and how it's receiving those inputs. And so if it's not receiving, hey, you're good, you're relaxed, you can sleep good, you can recover well, your hormones are great. If it's not receiving those information properly, then all the things you do can be in a way helpful, but it's building off of a very rocky system, a very, it's, using the Bible kind of as the example is like, it's your foundation. So do you want to build on rock or do you want to build on sand? And so if you build on sand, when a storm comes, all that stuff goes right back away. And so if we can build off of a solid foundation, you can see a lot of cool fruit that comes from that in all areas of your health, which is really cool. Because what we're talking about now isn't just about, fertility, isn't just about healthy pregnancy. It's about everybody's nervous system and how it can optimize and grow and adapt.
Yeah. So a couple things you mentioned, like safety is part of that parasympathetic nervous response. And, you can sleep, you can do all these things when your body feels like it's safe. And part of that, like we covered earlier, is producing hormones, being able to conceive when your body thinks it's safe. Because if your body thinks it's running from a lion, that is not the time to have a baby. It's like we're going to put all of that off. We're not going to make hormones. We're not going to conceive because this is not the right time because we're fighting for our lives right now. And then you talked a lot about the foundation. So I kind of want to bring that into what we're talking about and just how we like reordered my guide a little bit to make
Yeah.
it the number one foundation because I did have like blood sugar stability and sleep before nervous system regulation. And
Yeah.
you explained to me like, actually, we need this even before that because, like you said, it impacts sleep, it impacts everything else.
Yeah, definitely. Even our insulin, is a critical thing that people talk about with preconception. And it's especially like relevant with like the PCOS, the diabetes, the blood sugar imbalances and all that. But it is regulated by our nervous system. And so, both of those like sympathetic, parasympathetic pathways and like they basically converge on the vagus nerve. And so it's all around, this is nerdy talk, but all around like that T6 to L2 area. And so that's why we talk about, that's an area for our adrenals and all that kind of stuff. And we can get stuck in a completely wrong state because of that kind of stuff too. So it'll affect our blood sugar there and it'll affect our body getting stuck in that protective state, cortisol being high, which is not the environment that your body needs for that optimal fertility. Doesn't mean people can't get pregnant, because we can have really trashed nervous systems and see a lot of really cool things that still happen. Um, but we're more so, hey, how do we optimize the body to where, it's kind of like you're preparing for a marathon. How do we prepare? How do we do the things to get ready for that? Because even, and I know you talk a lot about it, but like our sperm turnover, they say it's on average at least like 74 days. So like for men's reproductive health, there is a big component of that that's super important, of how their nervous system's functioning, that
Hmm.
gets them to the point of like, hey, how is my sperm to actually have this baby? And for women, it's like 90 to like 120 days. Correct me if I'm wrong, but it's like anywhere from there. So there's a lot of turnover and a long time that kind of to hit that preconception optimal health. And so there's a lot that you can do to prepare your body for that state. And it takes time to prepare the body to where your nervous system is at a point where, yes, like I've been eating healthy for a week or a few weeks and all that, but how do we get all these things to prepare it so to where my insulin's going to regulate better to play a part of that? My cortisol is going to be better, so these are going to be better. So like getting all those things ready. And I don't know if I completely answered your question, but that's kind of where I was feeling that go there.
If you're trying to conceive and looking for a natural way to better understand your cycle, I personally love and use the KEG fertility tracker. It's actually what I use while trying to conceive Danielle. KEG is a medical grade fertility tracking device that gives personalized fertility tracking through cervical fluid patterns in just 1 minute a day. Unlike ovulation strips that only predict a hormone surge, KEG helps identify your fertile window in real time. A few things I personally love about it: it's a one-time purchase with no monthly subscription fees or ovulation tests. It comes with a 12-month pregnancy guarantee or your money back, and you can use HSA or FSA funds to purchase it. If you want to check it out, you can use my code Functional Medicine for Moms for $20 off, and I'll have the link down in the show notes. Again, that's Functional Medicine for Moms for an additional $20 off the KEG fertility tracker. Yeah. And I guess with your experience too, as a nervous system focused chiropractor, what do you see as that turnaround when you're able to see the scans? The scans are more of a tool than anything, but you've probably had experience before doing the scans and utilizing them and then afterwards. And what do you see with your clients and your patients on how they've improved with their health? Maybe you've even seen some people who have struggled with fertility and then be able to conceive too.
Yeah, I would say the cool thing is we always, every single person that comes in this office, maybe it's a baby, a prenatal patient, someone trying to conceive, someone older, we always scan every patient. And that might look a little different. If it's a newborn, we're not going to do an EMG scan and look at how their muscles are supporting themselves, because they're not supporting themselves yet. But we can still run the thermal scan and we can still run a heart variability scan on all ages. And so it's super insightful to see what's going on there. And so then we can look at, hey, how does this play into overall function? And so I feel like I'm getting off on tangent. What did you say? Ask again specifically.
Well, I was just enjoying your conversation. So let me think. But I guess what is the turnaround and what do you see with improvement on
Oh,
an
yeah.
experience level?
Yeah. So from that, I guess what we get to see with each like subsequent scan is like, and I say on average, not every single case is going to be exactly 12 visits to where we scan again. There's some more intense cases where we're actually scanning more often in the beginning too, but we get to measure how there's like the objectively look at how the nervous system kind of presenting itself at the time. And so can you see, I would say most often we see a lot of people who are in protective, or even exhaustive states, and change in the beginning is not always fun. And so we're trying to create change to a stagnant system that's then stuck in that stagnant state. And so change can be kind of messy. When people are moving and doing new jobs and all that kind of stuff, it's stressful at first. And so when our nervous system is changing, when it's starting to be aware of dysfunction and things that it's closed off to, it's opening up a door for new possibilities. And so I like the analogy of kind of cleaning out a closet. And so when I see a lot of people, the first phase of care, a lot of times we see their body is going to be that exact same thing. It's like, we're going to take what's going on in your nervous system, we're going to clean it out, we're going to see the mess that's in front of us. And so that's typically what that first phase is, like we're going to see them as, let your body start to identify those problems, because a lot of times our body's not working through problems. It's just stuck in that cycle of dealing with problems. And so we're going to start to recognize those problems and then start to work past them. And I would say I mean, most people don't come in our office and right away are like, hey, everything's better. Like, yes, like sometimes, hey, maybe I've a little less pain or I feel a little bit better. But most often our people that come in, we see like, hey, I slept better last night. I had more energy. I felt like I was digesting my food better, or like just very like foundational things that our body needs to get back to in order to heal. Very parasympathetic based things that our body's like, hey, I was able to rest. I felt like the noise turned off in my head and I was able to like go into a zone. It feels zen again. And so those are kind of the things that we're looking for first, is how do we get the body foundationally back to a state where it's ready to heal and it's happy to heal.
Mhm.
And so that's kind of what we're looking at as far as that goes, is how do we see those, what we call soft signs of nervous system change? Because coming in here, and if your goal is like, hey, I want to get pregnant and I've struggled with fertility for a long time, that's an awesome goal. It's a big goal. And so there's a lot of healing that your body has to do in order to get to that point. And so most often I tell people, we're going to focus on the small things. We're going to focus on, hey, what's happening day to day? What's starting to change for you? If you're feeling a little bit more at peace, your body's going to get less stuck into that sympathetic place. It's going to be able to get back into a more parasympathetic place. We might sleep a little bit better. Might start to go down. We might digest our foods better. And when we're digesting our foods better, our body's nourishing itself better. Our hormones are going to be happier because it needs those nutritional things to actually produce proper things too. And so then you see the cycle start to break over time. It just takes a lot to disrupt that system that's been that basically that stress muscle has been so strong. And so it takes a little bit to disrupt that system to start seeing that healing momentum start to roll, basically.
Perfect. And obviously, different healing depends and length of time depends on how long you've been stuck there, how much work we have to get done, what that scan might look like to give us a better like treatment progression plan as well. And when you talked about like all chiropractors are going to have some sort of influence on the nervous system, but some are more of like a side effect of it versus like the goal of it. So, what makes a nervous system chiropractor different than, I guess, a typically trained, conventionally trained chiropractor?
Yeah, I would say, I mean, regardless, every chiropractor I really like. I mean, there's going to be good and bad ones, but I went to a conventional one that first kind of led me onto this journey. And it was due to a back issue myself. But when you start to experience some of the changes that happen from it, there's got to be an explanation. And it comes back to that nervous system. And so I'd say you can go to anybody and get good results. But if you can go to somebody who's focusing on the nervous system, I think you can get a lot better result of it, because they can care plan properly. And I would say that's the biggest thing I tell people, is care plans are where the results happen. Is if a chiropractor is not giving you a care plan, which I know for a lot of people, like, I just want to pop in, get out of pain, stuff like that, which is great. It's just not what we do in our office. Care plans are where we're intentionally designing plan around what's going on in that person's nervous system for the sake of getting it out of that stuck stress mode that it's on and actually getting it to a better place. Because I would say a lot of chiropractors in general are looking at the pain side of things and like, or dysfunction in general. And some are going beyond that. But by being able to measure it, we can care plan properly. And I always tell people, I'm like, when you're coming to me, I'm probably going to recommend more often than most chiropractors you've seen, and maybe for longer, to get the body to a better place. And then we're also going to talk about kind of some degree of wellness care, because stress happens, and the more we can get our body to adapt around those stressors at that foundational level, the better off a lot of our health is going to be. So, specifically, I'm, certified within PX neurotonal technique. And so the PX docs is paving a way for a lot of people to really learn and dive into nervous system. And almost everyone you see is going to have an insight scan in their office, and not just have an insight scan, but they're going to extensively train on patterns that show up with those insight scans. So that way we can help, kids with autism, seizures, epilepsy, epilepsy, all kinds of underlying neurological pandas, POTS, like all kinds of different things that are related to those stress. But we don't treat those directly. We just get to look at what's going on in the nervous system, what's going on with this person. How do we remove those interferences to optimize their health, optimize our pregnancy health, optimize our babies? And that would be, one of my biggest mission is how do we break the cycle of, all these diseases and chronic dysfunctions that are showing up in
Hmm.
our kids. And it really starts with, hey, how do we make sure mom is as healthy as possible and dad is as healthy as possible? So then we create a life that's as healthy as possible. And how do we support that mom through that pregnancy to where everything that that baby is getting is as optimal as possible, to where when we have a birth that's as best as possible and a start to life as good as possible. So, and that's one of the coolest things is like, hey, how do we disrupt that stress cycle and let that body do everything it should do naturally? Yes, some people, some bodies are going to need additional support, additional things to build off of that. But I would say the important part is it builds off of that. And so if you can start with that nervous system and then everything you do from there, may it be additional therapies, diets, detoxes, all kinds of different things, you can see the body be able to handle and coordinate those things a lot better.
Beautiful. I actually recently had a chiropractor as well talk about ear infections in babies and kids.
Yeah.
And she talked about how the stress, even during pregnancy, is going to impact the baby, which can impact how they respond and have those subluxations early in infanthood. And then that can cause ear infections, allergies, a lot of other issues going on in life. So I think it just like brings it all back together, especially when you're talking about getting the nervous system in a better place before pregnancy and then throughout pregnancy, like you said, and then so on and so forth.
Yeah.
And
Yeah.
how that really impacts the health, not only of the mom and the pregnancy, but of the baby you're, creating that
Yeah.
life for.
Yeah, it's like so many people are like, "Hey, how do I get pregnant?" But it is also there's a process of how do I sustain a pregnancy? How do
Mhm.
I optimize my health through this? Because if your pregnancy is really rough, that's going to impact baby too, but it's also
Yeah.
going to impact mom's nervous system. And so,
Mhm.
if mom's super stressed out, doesn't mean that postpartum period is just going to be amazing. There's a lot of things that you have to lay that foundation for to set yourself up for success in those things.
For
Because
sure.
kids are not always easy.
Yeah. That's for sure. Postpartum, that's a tough one for sure. And then I have one more question. So, what would you encourage someone to focus on if they want to conceive in the next 6 to 12 months?
Yeah, I would say if you're not already seeing a nervous system focused chiropractor, find one. And so
And I'll
there's
drop that link as
yeah.
well.
Yeah, and
Mhm.
so I would say that would be a big thing, and don't be afraid to commit to something. And so, like I told you earlier, is like we do care plans, and so sometimes people see that and they're just trying to push a salesy thing and go through that stuff with people. And I just really want to just give people genuine recommendations, and so don't be afraid to listen what that person's genuine recommendations are, especially if they don't see insurance. And so insurance is one thing that will dictate a little bit about what people can or can't do with that. And so by not doing insurance, I can give you my genuine recommendations for what would work best for you specifically, your case, and actually care plan properly around those things and get people to, heal at that root level. And then get to build everything else on top of it. So don't be afraid to try something that's natural, take a little bit of a leap of faith and really get back to root cause healing.
Thank you. And where can they find you, Dr. Austin?
Yeah, so I guess we do a lot of content on our social media. So it's at lighthousechiropractictx.com, or well, our website's at Lighthouse Chiropractic TX, but at Lighthouse Chiropractic TX on Instagram, Facebook, all that.
Yeah. Yeah. You have a beautiful spot in Flower Mound, and I think you guys are doing awesome. And thank you so much for your help today.
Yes, yes. Thank you for bringing me on. I love what you're doing and the message you're spreading, and honestly, just helping more people through that platform.
Thanks so much for listening to my podcast, Functional Medicine for Moms. If you enjoyed today's episode, make sure to subscribe so you never miss one, leave a quick 5-star review, and share it with your mom friends who love it too. I'm Kelly with a background as a pharmacist and training in functional medicine. I help women move past fatigue, brain fog, gut issues, and hormone struggles so they can thrive in everyday life or prepare for a healthy pregnancy. Through lab testing, personalized supplements, and functional medicine coaching, I help you feel better, faster, naturally. Want to connect more? Head over to molinmethod.com or come hang out with me on Instagram and YouTube at Functional Medicine for Moms. On my site, you can order professional grade supplements at my discount or book a free discovery call if you'd like to see how we can work together on your health. This podcast is for educational purposes only and not medical advice. Always talk to your provider before making changes to your health plan. And remember, healthy moms raise healthy families. Catch you next time. New episodes released every Wednesday.